3, 2, 1. The Subcommittee on Africa, Global Health, Global Human Rights, and International Organizations will come to order. Without objection, the Chair is authorized to declare a recess of the Subcommittee at any point, and all members will have 5 days to submit statements, extraneous material, and questions for the record, subject to the length limitation in the rules. To insert something into the record, please have your staff email the previously mentioned address or contact full committee staff. As a reminder to members, please keep your video function on at all times, even when you are not recognized by the chair. Members are responsible for muting and unmuting themselves, and please remember to mute yourself after you finish speaking. Consistent with House Res 965 and the accompanying regulations, staff will only mute members and witnesses as appropriate when they are not under recognition to eliminate background noise. I see that we have a quorum and will now recognize myself for opening remarks. Pursuant to notice, we are holding a hearing on COVID-19 pandemic response in Africa. Today, we are hearing testimony on the COVID-19 response in Africa and what the international community can do, particularly the United States, in light of facing our own healthcare crisis. We hope the panel today has policy recommendations that can help the international community slow the spread of the pandemic in Africa, places where health institutions and economic systems might never fully recover. Even though our own country is being hit hard by the pandemic, ignoring the continent's plight will affect our national security and the ability to trade in the long and short term. South Africa is viewed as the best prepared of any country in sub-Saharan Africa to battle COVID-19, and yet they have more than 400,000 cases, well over half of the continent's total, per the AP. Surely it will be a ripple effect for countries with fewer resources, weak governance, and economic institutions. However, several countries have pursued innovative pandemic responses. Senegal is developing an affordable, rapid COVID-19 test kit, while Rwanda and Ghana pioneered the use of drones to deliver medical supplies to rural areas. But there are countries, such as Zimbabwe and Guinea, that use COVID-19 to restrict press freedoms and free speech and arrest and detain people who oppose the government. Therefore, my colleagues and I would like to know how we can deter governments from using this very serious pandemic for their own political gains, how U.S. foreign assistance can continue to strengthen the efforts of countries that are developing preventative measures, and what is the long-term impact on the United States if Africa does not receive timely resources to combat COVID-19. I would like to thank our witnesses for taking the time to meet with us, especially in person, on this critical issue that affects all of us. Unlike Ebola, which only affected certain countries within the continent, COVID-19 has spread transnationally, and so we are all in this together. Assistant Secretary Nage, I look forward to your remarks and analysis of what we can do legislatively to ensure the continent does not have an economic collapse, but thrives for the next generation. Mr. Maloney, thank you as well for your time. I understand you led the development of USAID's new strategic approach focused on building countries' abilities to plan, finance, and implement solutions to develop their own development challenges. So I am very interested to hear your thoughts on the response to COVID-19 in Africa with its many challenges. Many African governments lack resources to stockpile food, import medical equipment, and protect their local informal economies. This has caused leaders to seek international aid, and the most vulnerable seek debt relief. COVID-19 will also have an impact on elections in Africa, and free and fair elections are vital to a strong democracy. With scheduled elections coming up for Tanzania, Côte d'Ivoire, Burkina Faso, Ghana, Central African Republic, and Niger, COVID-19 could impact the perceived fairness and legitimacy of those elections. This means that countries will have to be transparent with citizens during the electoral process. My colleagues and I in Congress want to continue supporting Africa's health systems, humanitarian needs, encouraging free trade, bolstering food security, promoting democracy, and countering China's influence. Although the United States has pledged more than $400 million to Africa for health, humanitarian, economic, and governance assistance to respond to COVID-19, we want to make sure there is sufficient funding and that it is being implemented in the right places. COVID-19 has caused national lockdowns, border closures, and restrictions, which has destroyed the tourism sector, ultimately disrupting Africa's intra-regional and global economy. It will benefit our national security and economic interest to support the continent and help sustain its economy and health infrastructures, or somebody else will. I look forward to hearing your testimony and what Congress can do to continue to help millions of people from falling into deep poverty from the impact of COVID-19 in Africa. I now recognize the ranking member for the purpose of making an opening statement. I now yield to our ranking member, Representative Smith, for his opening statement.
Thank you very much, Madam. Thank you very much, Madam Chair. It is an honor to welcome our distinguished witnesses, Assistant Secretary Tibor Naj and Acting Administrator Chris Maloney, to the subcommittee. Thank you for being here in person to update us on the response to COVID-19 pandemic in Africa. The fact that the number of reported COVID-19 deaths as of July 27th in sub-Saharan Africa is nearly 12,000, less than the 15,800 COVID-19 deaths in my home state of New Jersey alone, may mean that deaths are significantly underreported, or that testing capacity is limited, or that the pandemic hasn't hit yet as hard or as it has in other regions. According to WHO, South Africa alone accounts for 57% of all COVID-19 deaths in sub-Saharan Africa, further suggesting underreporting in the other nations. But as Assistant Administrator Maloney points out and says, with concern, we are seeing a worrying acceleration in various spots around the continent, including in Nigeria and in Ghana. Please update us, if you would, today on how and why, or not why, but how the nearly $1.8 billion in foreign aid funding to prevent, prepare for, and respond to COVID-19 is being spent. Is that money in addition to other resources that were reprogrammed or put into the effort? It would be great to know what that all looks like and whether or not that is enough. And I would appreciate your take on how COVID-19 compounds other crises. Part of that is political, where we see a country such as Ethiopia racked by civil disorder amid a health crisis, where we see members of governing elites in countries in West Africa succumb to COVID, such as the Chief of Staff to President Buhari. We have also seen pretextual crackdowns on legitimate civil dissent justified by COVID-19 concerns in countries such as Zimbabwe and in Nigeria. More specifically, however, there is a very real, dangerous food insecurity crisis attributable to the plague of locusts of biblical proportions looming in East Africa, in response to which has been inhibited by the need to check COVID. Yesterday, H.R. 7276, a bill which I introduced, joined by Chairwoman Bass, was marked up in the full committee. It calls for a coordinated response, a strategy, and a working group to mitigate the desert locust crisis. I would point out that Mr. Barza was here about a week ago and gave us an update on how the over $19 million at USAID is being spent, again, to affect that crisis, and perhaps there will be more money put into that pot, but I would appreciate any thoughts you have on that and its relationship with COVID-19. What people may not realize is that the scope of logistical obstacles to addressing that crisis and others is compounded by COVID-19. There has been difficulty in getting assets in the air for spraying, in part because pilots flying planes with necessary pesticides have been quarantined for up to 2 weeks while en route to staging areas in Kenya and elsewhere. We have seen how food supply chains in the United States have become fractured and frayed due to COVID-19. Just imagine in a continent where the infrastructure is still building out, and the roads and bridges are not where they will be in some time in the near future, how much more difficult that makes it for them to meet the crisis. And of course, vulnerable food insecure people, a number estimated to be over 26 million in East Africa as of now, are at heightened risk for disease, including COVID-19. So we must focus on combating COVID-19, no doubt about it. I do ask that we not forget and I know you won't, the other ancillary issues that cannot be neglected as we keep that focus. Thank you again for being here. I look forward to your testimony.
I will now introduce our distinguished witnesses. Assistant Secretary Tibor Naj, thank you for being here today. I hope I said that correctly, Ambassador. You can feel free to correct me when you speak. Ambassador Naj is a retired career Foreign Service officer, spent 32 years in government service, including over 20 years in assignments across Africa. He served as the United States Ambassador to Ethiopia, Guinea, as well as the Deputy Chief of Mission in Nigeria, Cameroon, and Togo. Ambassador Naj has received numerous awards from the U.S. Department of State in recognition of his service, including commendations for helping prevent famine in Ethiopia, supporting the evacuation of Americans from Sierra Leone during a violent insurrection, supporting efforts to end the Ethiopian-Eritrean War, and managing the United States Embassy in Lagos, Nigeria during political and economic crises. Following his retirement from the Foreign Service, Ambassador Naj served as Vice Provost for International Affairs at Texas Tech University from 2003 to 2018. During that time, he co-authored Kiss Your Latte Goodbye, Managing Overseas Operations, a nonfiction winner of the 2014 Paris Book Festival. Our second witness is Christopher Maloney, the Acting Assistant Administrator in the Bureau for Africa. In this capacity, he oversees 47 countries and 8 regional programs in sub-Saharan Africa with a USAID and U.S. Department of State budget of $8.5 billion of assistance in fiscal year 2018. Prior to assuming this role, Mr. Maloney was the assistant to the administrator in USAID's Bureau for Policy, Planning, and Learning, where he led the development of the agency's new strategic approach focused on building countries' abilities to plan, finance, and implement solutions to solve their own development challenges, known as the Journey to Self-Reliance. He continues to provide overall oversight on this initiative as the agency operationalizes this new approach. Prior to joining USAID, Mr. Maloney spent 5 years at the Millennium Challenge Corporation, MCC, where he was the managing director for country selection and eligibility. Mr. Maloney also spent 5 years with McKinsey & Company in Johannesburg, South Africa, and Washington, D.C., where he focused primarily on agriculture, mining, and pharmaceutical clients in both the public and private sectors, including consulting on numerous Feed the Future strategies at various USAID missions in Africa. Prior to McKinsey, he worked with Genesis Analytics, a South African economics consultancy based in Johannesburg, as well as in the Office of African Nations at the U.S. Department of Treasury in Washington, D.C. Mr. Maloney holds an MBA from the Harvard Business School, an MPA in International Development from the Harvard Kennedy School of Government, and a bachelor's degree in economics and African-American Studies from Stanford University. I will now recognize each witness for 5 minutes, and without objection, your prepared written statements will be made a part of the record. Ambassador Naj, you are recognized for 5 minutes.
Thank you. Chair Wild, Ranking Member Smith, members of the subcommittee, thank you for inviting me to discuss the United States partnerships with the people and governments of sub-Saharan Africa, working to meet the urgent and unprecedented challenges of the COVID-19 pandemic. I am pleased to be joined by my Usaid colleague, Acting Assistant Administrator for Africa, Chris Maloney. We both rely on the bipartisan commitment of Congress and the talented women and men of the State Department and USAID as we work towards solutions for this pandemic. Over the past 20 years, the American people have invested more than $100 billion to strengthen public health sectors in sub-Saharan Africa, enabling them to respond more effectively to HIV/AIDS, tuberculosis, malaria, Ebola, and other infectious diseases. Since March, the United States has committed an additional almost $470 million COVID-19 specific response funds to the region. We have also contributed nearly $20 million in humanitarian assistance to combat the decades-high desert locust infestation, which is currently impacting 8 countries in East Africa. These commitments underscore our role as Sub-Saharan Africa's staunchest ally in promoting the health of its citizens. Our government, U.S. philanthropists and nonprofit organizations, and American businesses invest heavily in building a healthier Africa because a healthy population makes Africa and the rest of the world safer and more prosperous. This long-term approach stands in sharp contrast to others, like the Chinese Communist Party, whose defective goods, slipshod infrastructure projects, predatory lending habits are designed more for the benefit of the CCP than the well-being of Africans. It's no secret that China is by far the largest bilateral official creditor to African governments, creating an unsustainable debt burden, while the overwhelming majority of U.S. foreign assistance comes in the forms of grants rather than loans in order to promote transparent, private sector-led economic growth that benefits all parties. We strongly support the G20's debt service suspension initiative. Public disclosure of official loans helps hold governments accountable for their decisions and prevents the corruption, fraud, and abuse that siphons off money that is supposed to go towards African health and development. While strong leadership and early decisive action has likely helped many countries delay the harshest impacts of COVID, we must be clear-eyed about the situation today and mindful of the difficult days that lie ahead. Soaring unemployment, increasing food insecurity, ballooning budget deficits are also significant concerns. The secondary effects of unanticipated migration flows, declining commodity prices, diminished tourism revenues, rising food prices are just some of the problems now facing African governments. Of particular concern, the COVID-19 pandemic has placed the Sudanese democratic transition in an even more precarious place. Avenues for international support through international financial institutions remain constrained by the international community's inability, as well as our own, to proceed with heavily indebted poor countries' debt relief. We continue to focus on efforts toward rescission of Sudan's state sponsor of terrorism designation, which would help advance this process. Congress could support our goals in this regard through the adoption of legal peace legislation as part of any COVID-19 supplemental, which would have the added advantage of allowing a recently agreed-upon claim settlement outline for victims of the East Africa Embassy bombings to proceed. Pushing Sudan to provide compensation to these victims of the Bashir regime's acts of international terrorism is among the department's highest priorities. Finally, I would like to underscore the critical role of alumni of State Department exchange programs such as Fulbright, the International Visitor Leadership Program, and the Young African Leaders Initiative, or YALI. The nearly 20,000 combined alumni of the Yali Mandela Washington Fellowship and the Regional Leadership Centers in Africa, and the more than 650,000 members of the online YALI network represent a new cadre of African leaders who are willing and ready to lead change. Many are at the forefront of efforts to contain the spread of COVID-19. Continued commitment to these programs will empower Africans to take the lead on charting their future based on pro-U.S. models of governance, innovation, and development. Thank you for the opportunity to testify. I look forward to your questions and to working together to meet these enormous challenges to further advance health, peace, and prosperity in the region. Thank you.
Thank you for your testimony. Mr. Maloney, you are recognized for 5 minutes.
Chair Wild, Ranking Member Smith, and members of the subcommittee, thank you for inviting me to testify today on the response by the U.S. Agency for International Development to the COVID-19 pandemic in sub-Saharan Africa. It is an honor and a privilege to testify in front of this subcommittee, and I thank you for your bipartisan commitment to the countries and people of Africa. I'm pleased to be joined today by my Department of State colleague, Assistant Secretary for African Affairs, Tibor Nagy. First, a few facts. As of July 27th, sub-Saharan African nations have reported close to 713,000 cases of COVID-19, a number that has more than doubled since July 1st. As mentioned, over 60% of these cases have been in South Africa, but we are seeing acceleration in various spots around the continent, including in Nigeria and Ghana. But we do not know what we do not know. Testing is low and data is weak and incomplete. As a result, it is too soon to say how widespread the outbreak could become in Africa. We know some places are going to be hit hard and have already been hit hard, while others will get hit less hard. And a wide range of factors are at play, from demographics to geography to governance. The good news is that despite how complex this situation is, the United States is playing a leadership role in helping Africans successfully respond to this crisis. As of July 29th, the U.S. government has committed nearly $470 million to 45 countries across sub-Saharan Africa to respond to the COVID-19 pandemic. The U.S. government's roughly $100 billion in investments in Africa's public health over the past 20 years have built deep, trust-based relationships across the continent and platforms that have allowed our country partners to quickly pivot thousands of community health workers and related interventions to rapidly respond to COVID-19. No other country, certainly not malign actors like the People's Republic of China or the Kremlin, can match this unparalleled generosity. It's also important to note that we are working in two other critical areas: mitigating food insecurity and humanitarian needs, and lessening the second and third order effects of the pandemic. Let me provide a little bit more detail on these areas of work. So first, on the health side, we know that what happens elsewhere in the world can affect us here at home. USAID's health assistance in Africa related to COVID-19 focuses on saving lives by improving public health education, protecting healthcare workers, strengthening laboratory systems, supporting disease surveillance, and boosting rapid response capacity. For example, in Nigeria, USAID launched a partnership with cell phone provider Airtel to provide critical information via voice and text messages on physical distancing, safe hygiene practices, and other preventative measures to contain the spread of the disease. Through this partnership with the private sector, we can now distribute the latest public health messaging instantly to over 1 million citizens a day. Now, a little bit more detail on how we are responding to COVID-19 in the food insecurity and humanitarian needs space. Responding to the health challenges alone will not solve the crisis. We must proactively and comprehensively address how the COVID-19 crisis has eroded food security and worsened malnutrition across sub-Saharan Africa. The Famine Early Warning System Network, or FUSENet, funded by USAID, estimates that 113 million people will be in need of emergency humanitarian food assistance this year, which is an increase of almost 25% over last year. To that end, USAID is working with the World Food Program and non-governmental organizations to invest over $120 million of COVID-19 supplemental humanitarian resources to address emergency food needs in over 17 countries in Africa. We also are addressing disruptions to agricultural production, trade, and local markets, the loss of livelihoods, and the deterioration of essential social services like water and sanitation, while also building long-term resilience. And finally, I want to talk about how we are working to reduce the second and third order impacts of the pandemic. Before this crisis, the economic growth estimate for the African continent for 2020 was 3.9%. Now, according to the World Bank, Africa's GDP in 2020 could contract by between 2 and 5 percentage points, the continent's first recession in over 25 years. One way we are working to push against this decline is through Prosper Africa. USAID is adapting existing trade and investment tools and creating new ones to help businesses adjust their strategies, protect their investments, and find new opportunities in response to COVID-19. As an example, a recent $2 million Prosper Africa COVID-19 rapid response solicitation received hundreds of applications in a matter of weeks. We're also very concerned about democratic backsliding and have seen how some African regimes are using COVID-19 to restrict democratic space and constrain media freedom. We have seen severe crackdowns on perceived violators of lockdowns, elections getting postponed with little sense of a way forward, and serious disinformation campaigns. To push back against this, in Mali, for example, we are working with a range of stakeholders to counter dangerous misinformation about the sources and spread of the novel coronavirus. In conclusion, looking long-term, we remain committed to working with governments, civil society, faith-based organizations, academia, and the private sector in our African partner countries through this pandemic now and into the future. No other nation can match our unparalleled generosity, our open collaborative approach, or our long-term commitment to helping communities on their journey to self-reliance. Thank you again for this opportunity to address this subcommittee, and I look forward to your questions.
Thank you for your testimony. I will now recognize members for 5 minutes each, and pursuant to House rules, all time yielded is for the purpose of questioning our witnesses. Because of the virtual format of this hearing, I will recognize members by committee seniority, alternating between Democrats and Republicans. If you miss your turn, please let our staff know, and we will circle back to you. If you seek recognition, you must unmute your microphone and address the chair verbally. I will start by recognizing myself, and my questions are for both of you. Feel free to answer as you see fit. We don't have a large panel, so I think we can probably work it out. My first question is to ask you to address the implications of the pandemic for U.S. policy priorities and engagement with Africa, specifically regarding development, responses to humanitarian need, health capacity building, security, cooperation, and trade and investment. And if you could, please discuss the administration's approach to addressing an ongoing pandemic-driven rise in acute food insecurity and extreme poverty in Africa. Let's start with that.
Yes, Madam Chair. On the U.S. policy priorities, the overarching policy priorities remain the same. Our long-term goal, obviously, is for a peaceful, prosperous Africa, giving cognizance to the fact that it's such a young continent where the population will double over the next 50 years. So that remains very much intact. Of course, then you get to the point of how COVID impacts that. And in each country, the situation is totally different. And I also have to add that our ability to exercise our policies have also been impacted by just the reduction in staffing of the U.S. embassies that we had to do in recognition of the COVID and the vulnerable staff. At my estimate, our U.S. missions are operating at about, in Africa, about 60% of staffing. And as you know, that U.S. embassies in Africa were the ones who have the lowest number of staff and lowest positioning, you know, in the various competencies. So that has been impactful, but the priorities remain the same. And right after the emergency started, I gave our ambassadors a kind of an overarching command to, number one, look very carefully at governments that would use COVID to abuse their populations and to restrict democratic place, but also to look and see where violent extremist organizations may be using COVID to expand their operations. Now, for the...
Thank you. Before we go to Mr. Maloney, let me just ask you a follow-up question, and then I'll ask Mr. Maloney to address both also. What have been the pandemic's effects on U.S. security and military cooperation in Africa?
Actually, the cooperation remains very strong because in some of the countries, it was the militaries who were the most effective in responding to COVID. Military hospitals, training that they have gotten from the United States, because as you know, Madam Chair, a lot of our training is what I would call in the soft areas of skills development, community outreach, human rights training, law and order, those types of things. So they've actually been very helpful in our cooperation. I have to say, and again, with 51 countries, it varies, but overall, it's been very close.
Thank you. Mr. Maloney?
Thank you. It's an important question and a complicated one, so I'll try and break it down into its three parts.
Do you have your mic on? I just want to make sure.
Can you hear me? Sorry.
Yes. Okay, go ahead.
So let me break it down into its three parts. I think from USAID, we're looking at this along three lenses. The first is the health, the second would be the humanitarian, and the third would be the second and third order, as I said in my testimony. So we have a double whammy on each of those three areas because at the end of the day, what COVID-19 has wrought is a massive risk towards backsliding, right? So I'm sure you've all seen the press reports that all of the investments that the US taxpayer has put into these health systems across Africa are now at risk. People cannot access services. They are unable to move around. It can be difficult to go to your doctor, et cetera. So we need to make sure that the work that we are doing in PEPFAR, in the Presidential Malaria Initiative, and in our maternal child health work, all of that can become what I like to say is COVID aware. So we've been able to redirect about a little over $100 million in all of those programs to make sure that they are able to build in COVID aware types things, whether that's being able to procure locally PPE for healthcare workers, or that could be making sure that there's just hand sanitizer, that there's proper communications, all of those things that the work that we do, we can mitigate the backsliding. But it's going to happen. It's just how much can we protect it from going back too far. So that's a key piece of the story, in addition then to all the COVID work that we're doing in response. So that's also, I think, an important thing to note, is that the good news is that because we've invested so deeply across the continent by developing platforms like PEPFAR and PMI and deep relationships with ministries of health, we've been able to pivot on a dime. Thousands of healthcare workers. It was very interesting to me. I was talking to colleagues in Uganda where healthcare workers we have trained to diagnose malarial fevers can now also look to diagnose COVID-type fevers as well. So there's a lot of wonderful, deep institutional work that we're able to pivot to this crisis. So that's what I would say on the health side. The humanitarian side again, things are going a little bit from bad to worse with this. So again, here it's making sure that with the very generous, and I would say the bulk of the supplemental that's gone to our humanitarian work, it's making sure that we are ensuring that COVID-19 does not wreak havoc in the most vulnerable communities in Africa. So that has been a key thing. A lot of the interventions we've been doing on the sort of classic health side apply just as much in a humanitarian setting, but then also adding in food assistance as well as necessary. So that's been that key piece. But then finally, the part that keeps me up most at night, we can see the health issues, we can see the humanitarian issues. The other thing that we can point to most directly is the democratic backsliding and the second and third order effects. That you can point to immediately. 105,000 people locked up in Zimbabwe, ostensibly for breaking lockdown. It's curious that they're largely urban and so therefore mostly aligned to the opposition. But even in democratic stalwarts like South Africa and Kenya, you're seeing heavy-handedness of police. Literally, people have died as a result of violating the lockdown. So how do we think through that? How do we work through each of our partners, wherever they are in the journey of self-reliance, to develop the right responses? So empowering civil society to counter disinformation, to advocate for the most vulnerable, to work with our human rights partners as well. This is all key to do across Africa on that front. And then finally, related to that, the other important second and third order effect is what's happening to the economic growth trajectory that Africa had been so positively on over the past 10 years. So in particular, agriculture means everything in Africa. And whether it's the global supply chain interrupting inputs or the ability for farmers to get product to markets on the supply side, the demand side is also quite broken because now with lockdowns and up to 80% of people in the informal sector, they have no money to buy food. So you have this double whammy on the supply and demand side when it comes to the key piece of the economic engine in Africa. So we're working very hard to think through many different types of innovative solutions to work on that supply side and the demand side. And speaking with my colleagues, one thing that's been very interesting to grapple with is how do you think through urban food insecurity? We kind of know how to do it in the humanitarian sense, but how do you do that in a place like Khartoum, which is something we're actually thinking through right now. So it's very multifaceted. It's a lot of learning by doing, but I think we're really well placed now, having learned a lot over the past 3 months, to keep pushing forward to mitigate the backsliding, but also address where we are right now.
Thank you very much. I may have some follow-up questions after I've given everybody else an opportunity to ask questions. I'm going to now call on members for questioning, starting with Mr. Smith, our ranking member.
Thank you very much, Madam Chair. Again, thank you for your testimonies. Let me ask you, how has important programs like PEPFAR and the President's Malaria Initiative been impacted by COVID-19? Are ARVs getting out to people who have tested HIV positive? Mother-to-child transmission medicines, have they been in any way inhibited or delayed? The whole array of response under PEPFAR, has it in any way been delayed or even denied? Secondly, on susceptibility to COVID-19 in Africa, do you see a breakout as to who is susceptible? We know what the underlying conditions are here. We know age is also a component. Is it the same there? And what are we finding with regards to that? And strategies to ensure that people are as safe as possible. I know nursing homes are not as prolific in Africa as they are here, but half of all the people who died in my state were senior citizens in nursing homes, half. Can you also tell us what drugs, interventions, therapeutics we are either purchasing or encouraging the use of to mitigate COVID-19 as somebody does get sick? Is there a list of things? I know remdesivir is probably not available. It has saved lives in my district and throughout the country, but I'm not sure how available it is there. What is available? Is hydroxychloroquine being used? I know, you look on CDC's website about how do you deal with malaria, and there's hydroxychloroquine for country after country. Is it in any way being deployed there? And is it having any inhibiting effect or impact on COVID-19? WFP Director David Beasley talked about the hunger pandemic coming from breakdown of economies, but also I get back to my first concern that I raised today, and that is the locusts. You might want to speak to how we need to do even more on mitigating that crisis going forward. And also, Ambassador Naj, you did mention bundling removal of Sudan from the state sponsor of terrorism into the COVID supplemental. I would respectfully suggest that state sponsor of terrorism removal is a very complicated issue. We have members of the transitional government linked to atrocities in Darfur, and I am one of those who went to Darfur more than once, like you and so many others. We know I met with Bashir himself. Too bad he never went and was held for crimes against humanity at The Hague. But Hamedi is still there, and there are other very, very dangerous people still in that orbit of governance. We also have settlements of claims against Sudan by victims of terrorism, not only the USS Cole, an embassy bombing, the Granville family victims, but also the 9/11 widows who seem to have been overlooked by the State Department. And I have many who live in my district. I've worked on that issue since 9/11 itself, particularly trying to help them the day after and the days after. Well, they are very upset as well. So I just, before I run out of time, I would like to yield to you for some answers.
Thank you, Ranking Member Smith. So let me start with the first one in terms of what we're seeing on the ground in terms of backsliding. It's real, right? So I would say on the PEPFAR front, the main thing is that clients cannot really move like they could before. So we've been thinking very hard about how we can get to the client. And so a lot of the work that's been done is training our healthcare workers and ensuring they have the right equipment and PPE to be able to go out into the field. So that's been a main thing that they've been working on from that PEPFAR side. On the malaria side, a main intervention has been developing global guidelines that can be used around the world on how to ensure continued implementation of bed net distribution, insecticide residual spraying, and of course, continued diagnosis and seeking of care. I made that example earlier of the Uganda fever detectors, which is quite interesting. So all of that continues. I think the main thing is trying to understand the dynamics. It's very unique from country to country. You know, in South Africa, this is more of an urban issue. When you're out in different parts of Africa, it's more of a rural issue. So how you respond, how you pivot is very, very country specific in terms of how that works. The final area is also something of big concern is when it comes to vaccine preventable disease. There's been a lot of technical support that we're providing to various African governments to restart and also adapt their immunization service delivery strategies to figure out how do you do that in this environment. And as you've seen, there already is quite a bit of backsliding in terms of percentages who are getting vaccinated, so this is something we're also working on quite closely. So again, it's this real tension between trying to mitigate what's going to be backsliding for sure, but trying to do it in real time.
Getting out, you know, malaria, diphtheria, pertussis, those kind?
There has definitely been a big decline, and this is what we're trying to work. So when we're saying restart strategies, they kind of, all these countries basically seized up. That's the way to think about it. So after these lockdowns have started to lift in varying degrees, just like here, it's been thinking through, okay, how do I pivot my strategy to now either catch up, and we'll see if they can, or not. And it's going to be quite difficult, but again, very country specific in that regard. In terms of the drugs purchases, I'd have to defer to my global health colleagues on this, but it's important to talk about what we actually have been doing specifically in the health front. So it is not, my understanding is not primarily on drugs. It's a mix of 6 things. The first is dramatically enhanced risk communication and community engagement work. So this important factor of knowing what you don't know and making sure that we're correcting misinformation is key in Africa. Simple things like face masks and washing your hands applies deeply. You can imagine that, particularly in an urban slum environment in Africa, how much that matters. Infection prevention and control, support to national lab systems, surveillance and rapid response teams, case management, and very importantly, coordination. There are many players in these games, so those have been the 6 areas we've been most focused on when it comes to the health response more than anything else. You asked a really interesting question, and one that I'm fascinated by, on the demography of this disease in Africa. Why is it 715,000? Without question, we are dramatically undercounting. But there's some important things to think about. There's a fascinating study that came out, and that's why I put it in my testimony, of 3 important factors to think about, and why it's important to think about this at a country level and not a continental level, because the experience is so different. The first is the demography. Remember that in Africa, something like 70 to 75% of Africa is under the age of 30. So chances are that when they get sick, it's going to be that little flu, right? And so we're not going to see it. They're not going to get tested, or they may be even asymptomatic. And this is a horrible thing to say, but when grandma gets sick in a place like Africa, probably the last place you're going to go is your hospital, even if there is one available. So that's just dramatically going to impact your ability to even see where this disease is going overall. The second is geography. This is a disease of global mobility. Why did South Africa get hurt first? Because it's the most global of the economies. It's why the Maghreb is doing, per capita speaking, much worse than sub-Saharan Africa, because it's where the economies are. And then the third piece is governance. You talk to President Magufuli of Tanzania, COVID disappeared on April 29th, right? And so this is very important. When you have good governance of good case testing and control, like Rwanda, you can be one of the 16 countries that can fly back to the EU. That is Rwanda right now, right? But right next door in Burundi, the president, who arguably may have been the first head of state to die of COVID-19, denied it until the very end, right next door. So it is really important to think through these different dynamics, because there is no one-size-fits-all, because it's playing out so dramatically differently country to country. Finally, just to address your question on locusts, sir, Obviously, this is something we've been focusing very closely on, and in particular with my colleagues in the Bureau of Humanitarian Affairs, who are, of course, the ones in charge of this, or the agency. As I know, Acting Administrator Barca spoke to you last week about the use of the $20 million, in my opinion, helped us dodge a real bullet, making sure that we were able to provide the critical equipment at the right time and place, aircraft, vehicles, pre-positioning as needed, et cetera. The estimates I've seen is that it's been able to avert a loss of almost 1 million metric tons of food. An important thing to flag, though, is that in that part of the world, it is very, very localized and also a moving target, which makes it very scary. But so far to date, it's terrible to say, only about 1 million people have been directly impacted by the locust from a food security angle. As you said before, though, 26 million surrounding those people are victims of drought, conflict, and other issues. So food insecurity writ large remains a tremendous problem. Locusts are the exacerbator. Where they go next is the big question. And I think we dodged a bullet in the spring. We need to make sure that as the rainy season comes in, Assistant Secretary Naj knows this part of the world much better than I, having served over there, but Ethiopia and Sudan, how this plays out, that's where we think the locusts are going next. It's working closely with the interagency, working closely with FAO to make sure that we're moving the right pieces of equipment to the right places, should this take off yet again. So I'll leave it at that.
May I have mentioned the SST? Because, sir, you absolutely brought up some of the complicating factors in SST rescission, because we have to recognize the rights of the victims at the same time as pursuing SST. That's why I think our special envoy, Don Booth, has been giving a number of consultations with staff, with members who are interested, because we recognize that this has to be done right. They cannot be done in a vacuum. So absolutely, I mean, that is our primary concern, is the victims. So absolutely, it's very complicated.
Thank you very much, Madam Chair.
Thank you, Mr. Smith. I will now recognize members by committee seniority, alternating between Democrats and Republicans. As we usually do in the subcommittee, I would like to ask that everyone stick to the 5 minutes, and then we will go for a second round of questioning. Thank you. Mr. Phillips, you are recognized for 5 minutes.
Thank you, Madam Chair, and greetings and gratitude to both our witnesses. Last week, I had the opportunity to speak with Acting Administrator of USAID, John Barca, and we spoke about one of my passions, the Local Works Program, which advances locally led development in countries all around the world. And I love this program because I believe it highlights many of ours, including the administration's priority of achieving self-reliance, which I know you played an integral role in developing, Mr. Maloney. So my question is to you, and you've touched on some of this already, but how is COVID-19 changing the way that USAID delivers assistance? And given the specific challenge and difficulties of travel for U.S. officials, how are you working to give more responsibility and ownership to local entities, including local NGOs?
Thank you very much for the question. I'm always pleased to meet other followers of the journey to self-reliance, something that's very near and dear to my heart. As a former Administrator Green used to say, ending the need for foreign assistance begins with local solutions and local works, right? So this has been a key piece of our response, including even in a time of COVID. So a couple of things that I would say. Obviously, the world is much more complicated because of movement issues around the continent, but in many ways, I would argue our local partners are therefore almost more important, in the sense that they are the ones who are able to get out, sometimes more than our traditional employers are able to. These are the ones who know the local situations far better than others. And so we've been doing all we can to make sure that they are a key piece of this story. An interesting piece of this, I would say, certainly would be on the Prosper Africa front. So you heard me mention earlier this rapid response on COVID-19 that we have out of our West Africa Trade Hub. Many of those applicants are small African-owned SMEs. We've been able to work with them to do things like pivot to production of local PPE. We've been able to work with them to get bridge capital, bridge loans to be able to keep workers employed, things like that. So they are also a part of the story. So it's not just a supply and response angle. It's also making sure that we're also thinking through that demand piece as well. So I would say that is a core piece of what we've been working on, certainly from the local solutions front. Thank you.
I appreciate that. And I happen to be a small business owner myself. I love ingenuity, I love innovation, and creative spirit. I'm hearing some great stories across all over the world. Students finding ways to wash your hands without touching any surfaces, and fashion designers producing masks en masse, cosmetic companies making hand sanitizers, and many of these opportunities possible because grantors have been giving their grantees flexibility in their contracts, creating alternative products to help address the pandemic while still generating revenue to keep the local entrepreneurs in business. So my question is, what is USAID doing to ensure that its grant programs are affording this kind of flexibility? And how is USAID supporting partners on the ground to ensure that projects like these are able to adjust and navigate these new realities?
Thanks for that question. A couple of things I would say. I mean, it goes back, I think, first we said before, is how important, particularly from an SME front, we're making sure that when we have pretty flexible mechanisms, like, for example, that request that we had out of the West Africa Trade Hub, that allows us to have that degree of flexibility to provide the bespoke support that a given SME might need. So that would be something I would say at sort of at one angle. At the other side of the story, though, is I think we've been able to find pretty good flexibility in everything from our Feed the Future work and others to make sure that through redirections, we can make sure that we can help make any intervention, whatever that might be, whether that's through what an SME might doing or a local faith-based partner we're working with on any sort of delivery mechanism that we have going on. They can pivot their response in a COVID-aware way. And that can take many different forms. I'm happy to get back to you with some specific examples. I don't have many off the top of my tongue, but I know they are out there. But that has been a key piece of the story as well. One final thing I also said, which I neglected to mention before, is just how important our local partners have been in the monitoring and evaluation standpoint. We've worked very hard, because they are the ones who are still out there, to think through very different types and innovative ways of doing the monitoring and evaluation of the work. So whether that's through mobile telephony, really thinking through different ways of trying to find the right types of indicators in these very constrained environments, they've been critical thought partners on that side as well. So I just wanted to put that point out there too. Thank you.
I appreciate it. Thank you, Mr. Maloney, and I'll yield the balance of my time.
Thank you, Mr. Phillips. Mr. Wright, you are recognized for 5 minutes.
Thank you, Madam Chair, and I want to thank both of the witnesses today for their testimony. My questions have to do with Cameroon. As both of you know, Cameroon's government and the Anglophones have been in conflict for some time. It's my understanding that much of the fighting continues despite the fact that there's been over 16,000 confirmed COVID cases and 382 deaths due to COVID in that region. My first question, Mr. Ambassador, do you have any insight as to whether the Anglophone region is being hit disproportionately hard by COVID-19, and to what extent their government is being helpful in containing the coronavirus in this region?
Unfortunately, sir, because of the lack of government and NGO presence in much of the Northwest and the Southwest, it's an area of ignorance for us when it comes to the statistics. We can't be sure. We can make assumptions, but we certainly cannot be sure of what exactly is happening there with the COVID numbers, as is true for so much of Africa. You look at some of the numbers and the rates, and they just make no sense whatsoever from a statistical point of view. And it's even doubly so in areas of conflict, such as the Anglophone zones of Cameroon, unfortunately. As I've said many times before this committee, Cameroon is one of the countries that keeps me up at night every night.
I understand.
And I would just echo everything that the Assistant Secretary said. My understanding is that there is some very limited PEPFAR and PMI programming in the Anglophone parts of Cameroon, but because of the unrest, we've had to step back quite a bit from that part as well. My understanding is there may be some limited DRL and CSO programming, but I would defer to the Assistant Secretary on that. And there is some humanitarian emergency food and preventative health work that has been done, but that would predate COVID. So everything that the Assistant Secretary said is definitely true from the aid standpoint as well. Our ability to operate in that part is quite difficult. But overall, of course, we have about 18 million in Cameroon right now in health and humanitarian assistance, and we can certainly get back to you on where that actually is going.
Actually, my next question was going to be for you, Mr. Maloney, and it has to do with that very thing, and that is having to do with how do we ensure that some of that 18 million is actually getting to the Anglophone region? Is there any way we can ensure that that happens?
It's difficult, it's challenging. It's definitely a conversation that I think we should have with Ambassador Barlerin. I mean, this is something that the Assistant Secretary and I would talk about all the time in given countries when we have issues like this. So this is something I think we can definitely take back and first just get a better understanding of where things are geographically in Cameroon right now with that supplemental, and we can then revert back on any sort of next steps out of that. But, Mr. Secretary?
Yeah, if I may add, anything having to do with Cameroon has to be overlaid with the problem of the conflict that's going on. For example, now the Cameroonian government is talking about a new UN development program for the Northwest and the Southwest. Unfortunately, there's just no way to, number one, implement that, and the Cameroonian government seems to forget that the number one desire of the people of the Northwest and the Southwest is to have a say over their own affairs. It's one thing to talk about development, but at the heart of it is their keen desire to have control over their own lives. And until the Cameroonian government understands that, all these plans are going to come and they're not going to succeed.
I agree with that. Thank you, and I yield back the remainder of my time.
Thank you, Mr. Wright. Mr. Burchett, you are recognized for 5 minutes.
Thank you, Chair Lady. I appreciate it. And tell me how to say your name. Is it Nagy, or how do you say your name? What? Tibor?
Tibor, my first name.
Okay, well, I'll just call you T. How about that? You can call me Tim. How about that? So everybody else calls me. I got you, Mr. Maloney. We're good. You know, I probably told the committee this before, but as a young man, I remember missionaries coming into our church when AIDS was just coming out and getting vicious as it was. I mean, I lost friends in Knoxville, Tennessee from AIDS, but they were talking about how whole languages were getting wiped out. And it's just hard for me to even fathom that as just seeing, like if I put that map over Tennessee and just taking counties out. And of course now with COVID, it just seems history's repeating itself because we don't know what's going on, where you get in there, and then of course the Chinese communists, who are the most miserable, I don't know, them or the Russians right now in my book are 1 and 2. I'm not sure which is which, but it disgusts me that the communists are taking full advantage of this, which they are, and that's in line with what my questions are. That wasn't a prepared statement. That was just something that from the heart right there. I know that in 2015, the U.S. worked with the African Union to establish the African Center for Disease Control, and China is reportedly planning to fund and construct the headquarters in Addis Ababa. Did I say that right? I think I got it with my East Tennessee accent. They similarly constructed the AU headquarters, which was reportedly bugged and the servers were hacked. And how can the U.S. push back on this effort by China to ensure the security of the African CDC?
Yes, sir. We are absolutely seized with that issue. It would be an unmitigated disaster for the Chinese to build the Africa permanent CDC anywhere. And that decision has not yet been made, actually, as to where the Africa CDC is going to be permanently. That is a decision that should be left to the member states of the African Union, not a committee of the African Union. So I understand that a number of African states are very interested in pursuing that. There will be an executive meeting coming up in a couple of months of the African Union, and I expect that some of the member states will be asking for that to be put on the calendar, because there are a number of the member states who are also quite concerned about that, based exactly what you said, sir, about the public reports of what happens to the data that goes currently through the African Union.
Yeah, it just strikes me, again, this isn't in my notes, just how heartless they are and just their ambition for world domination. I mean, it's just, after the Second World War, my dad fought in the Pacific, fought the Japanese all the way across. Then he had to go to China. It's not written much, but he went to China and fought the communists for a while. I mean, they've been at it, they've been at it for a long time, and they just continue. And I think it kind of disgusts me when we get sidetracked with what's going on in the world, because the Chinese, they're after us, and they're everywhere they go, Belt and Road. I mean, I don't believe they're ever going to take over Israel, but they built their deep port there, for goodness sakes. I mean, it's just amazing that we get so diverted in this country. Let's see, I got a minute 14. Let me go real quick to the how is the U.S. Messaging and pushing back on China in their influence campaigns, specifically in the sub-Saharan Africa? Because in the last 20 years, we provided about $59 billion with a B to sub-Saharan Africa to combat infectious diseases and strengthen health systems.
Well, you've hit one of my favorite subjects, and I'm sorry I don't have very much time to talk about China and Africa, but I'll make it very short. I think China gets chutzpah of the year on their pretend response on COVID. It's like in the African context. It's like,
that's not an East Tennessee term, so.
No, it's it's not
I'll
Hungarian
explain it
either.
later.
But
Ma'am? Okay, thank you.
But the example, the African context is
got
the guy who shows up in the morning and sets the village on fire, then shows up in the afternoon with a bucket of water and wants to get credit for putting it out.
Yeah.
You know, and we have spent, as I said, and what we both said in our introductory remarks, I think $100 billion on African health systems in 20 years. And now all of a sudden China wants to come in with some PPE equipment, so much of which doesn't work, and all of a sudden become the savior.
They want to go get their
Like
Nobel
I said,
Prize.
chutzpah of the year.
Okay, well, they get my Dirt Bag of the Year award, so you don't have to look that up. Sorry, Mr. Maloney, didn't have nothing for you, brother, but
You'll get a second round, Mr. Burchett, if
yes,
you want it.
ma'am. It's just Tim. Thank you, Chair Lady, and thank you, everybody, for your indulgence for my questions.
Thank you, Mr. Burchett. Mr. Sherman, you are recognized for 5 minutes.
First, I want to thank the chair for allowing me to participate. Although I'm a member of the full committee, I'm not a member of this particular subcommittee. We're spending trillions to deal with COVID. I would think it would make sense for us to spend 1% of that on our worldwide response. And I think it's very important to our worldwide response that we also fund research. Less than 1/4 of our COVID money has gone to research cures or the nature of the disease. And obviously what we do there, what we do in research helps the United States, Africa, and the world. There's one area where I think the Republican bill just put forward this week may be better than the HEROES Act. The HEROES Act decided to focus exclusively on domestic aspects of this COVID crisis. The Senate package provides $3 billion for global health programs, including Gavi, and $1 billion for international disaster assistance. And this is, of course, a disaster. We've seen a 135% jump in food insecurity in West and Central Africa, 90% increase in Southern Africa. I realize the administration doesn't always walk in lockstep with the majority in the Senate, but this would be a nice time to do so. Does the administration support the $3 billion and the $1 billion for an international response to COVID? And if it's not an official, can you just say nice things about it without being official if you're not allowed to be official? Do as much as you're allowed to do.
I'd have to get back to that on you, sir. Yeah.
That's the best you can do?
Yeah, and also I don't know that issue.
Okay.
I would have to get back to you.
I was in Steny Hoyer's office yesterday urging that the Democrats embrace this part of the Senate proposal. I'll point out that in the House Foreign Ops bill, we have substantial money to deal with COVID internationally, but that bill isn't going to become law. It's supposed to become law by September 30th. We know it's not going to become law till December, January. And I won't even ask the question, do we have to respond to this issue now in Africa, or is waiting till January a good idea?
Obviously, it goes without saying.
I'm known for asking the tough questions.
I appreciate the answer is the needs are tremendous, and the resources, as generous as they have been, are still far short of what Africa needs. The backsliding is huge, well beyond the capacity of even the United States with the gigantic bill. And so our ability to continue to mitigate the backsliding, whether that's in the health, the humanitarian, or the second order or third order fronts, is key. One thing, and just going over to Congressman Burchett's remark.
If I can reclaim my time. Acting Administrator Maloney, your written testimony, you highlight the success that we've had with PEPFAR and the President's malaria initiative. you put together your budget, or the administration put together its budget before the dimensions of this COVID crisis was known, and suggested a 34% reduction in global health programs. Now that we see that what happens there affects us here, and now that we see how terrible COVID is affecting there and here, do you think we should cut PEPFAR and the Malaria Initiative and other global health programs by 34%?
As I said, the needs in Africa are great, and they're well beyond just the capacity of the United States. It's key to think through burden sharing, our other donors, and also what our African partners can do. And so I think that's a key piece of the story. Certainly as USAID, we commit to doing as best we can with whatever is generously appropriated to us in this response.
And I do want to point out that many of our allies are providing a much higher percentage of their GDP to aid, development aid for Africa, and disaster aid for Africa, and health aid Africa that we are. Ambassador Nagy, did you have a comment?
Yes, sir. If I could just add one point. One of the considerations we always have to think about in Africa also is the absorptive capacity of various countries, because some countries can use that money efficiently, others obviously cannot. And I know that that's one of the considerations that went into the formulation of the individual country grants for COVID, because as much as it would be wonderful to just be able to throw money at a problem in some countries, we throw money at it, and a lot of the percentage is going to end up in the pocket of somebody as opposed to where it should go.
Okay. And I would point out that the disaster relief and the World Food Program, which I think has done a good job in general, makes sense. This COVID crisis is making millions of people hungry and perhaps starving, and I don't think there's any doubt that the World Food Program can use that $1 billion effectively, and I yield back.
Apologies for the oversight, Representative Houlihan, who is a member of the subcommittee. I now recognize you for 5 minutes.
Not a problem, and thank you, Madam Chair. My questions actually follow along Mr. Sherman's questions pretty nicely. As we all know, the United States isn't alone in fighting this pandemic, and so long as the virus does remain a threat in one corner of the world, it remains a threat to all of us. And I was disappointed to see that the HEROES Act, which we passed in May, didn't include any foreign assistance for funding, which is crucial in fighting this pandemic. And I am hopeful that the Senate version does include some foreign assistance, but it's not enough, in my opinion. And so we don't have to have the conversation necessarily about whether you're for or against it. But I would like to know, assuming that we should have a foreign assistance response and a large one, what are the most important international assistance programs for which we should provide emergency supplemental funding in an effort to be able to support COVID response globally and in Africa specifically? And I leave that to either of you gentlemen to help me answer.
And sorry, just to clarify, which of the, you were asking specifically about international organizations?
Exactly.
Right.
Assuming that there were funding that were decided upon wisely by both the House and the Senate in a very short amount of time.
Exactly. So first, I'd want to get back to you to be very specific to make sure I'm not giving you an incorrect answer, but I would look, again, very clearly at who our key partners have been along the 3 lines of work. So that, again, begins with PEPFAR, PMI, and those backsliding issues. I think WFP, particularly when we're looking at what's going on the food insecurity piece, they are a crucial partner, and they've been thinking out of the box with us in particularly this urban food insecurity space, which has been quite important. Also, of course, Red Cross and UNICEF, crucial partners, particularly since in numerous cases around Africa, we're having to do interventions in places where we don't traditionally work. A lot of the smaller states where we don't have a presence, UNICEF in particular has been a critical partner for us too. So again, I would say it's parts of the UN, certainly WFP, FAO, when we're talking about the locus as well, all key with us.
And going back to Mr. Sherman's line of questioning, you know, I think one of the frustrations as a new member of this body that I have is that help us help you. We need you to be able to articulate that you need help and that dollars matter and that funding matters. And it's very frustrating to sit here in my capacity and my position and have you not be able to answer whether help would be helpful. And that's a little bit constricting.
The help is definitely helpful. I just want to make sure we're giving you the very specific results.
No, I appreciate that. And I'll move on to my second question. Obviously, one of the most important pieces of our COVID response is the vaccine development. And I am definitely disappointed that this administration has started the process to withdraw from the WHO, or the World Health Organization. And we are declining to participate in many international efforts to coordinate vaccine development, production, and distribution. So as we are making progress on our COVID-19 vaccine response, and others around the world are as well, what do you view as the greatest barriers to equitable vaccine distribution and access across sub-Saharan Africa? And how can we build on programs that you just mentioned, like PEPFAR, as we prepare for a vaccine?
The good news is that we have, and we have shown through our COVID response, very strong platforms that can be leveraged for things like vaccines. So when it comes to supply chain, I would argue that the U.S. gets it more than many other players in the African health space. So I think leveraging those platforms will be key. I'd have to defer to my global health colleagues specifically on the nature of how and when and if we get a vaccine, how that would work in the African context. But certainly watching what's happened in terms of how we've been able to pivot these platforms for COVID and how well that has worked, particularly under the circumstances, I think gives me a lot of hope for when we get to that point.
Ambassador, do you have anything to add to that?
Just to add to what Chris said earlier, that Africa in many respects is a continent of paradoxes. You know, you have such a very young population, but because of the illnesses that most people have, they are still very vulnerable. On the other hand, we have some very underdeveloped health systems in some countries, but some of those countries have done a phenomenal job on Ebola, for example, response. So they have the systems in place where logically they might not, but they will when it comes to something like that. So as Chris said earlier, I think it's very much a country-by-country analysis based on lots of factors. For example, the political systems, the availability of local NGOs, conflict zones. So it will take careful analysis to make those determinations.
Thank you. And I know I only have 15 seconds. May I ask one more quick question?
Representative, we're going to do a second round, and you can just go ahead and use
Thank
yours
you.
now.
I'll quickly ask this one. I used to run a nonprofit that focused on early childhood literacy and had a very strong parental engagement component to it. And we've definitely seen here in the United States that parents are struggling with children being out of school during the pandemic. And I'm very concerned, not just here in the United States, but also in the global South, that we are going to lose a generation of kids who are not going to be able to achieve basic education because schools are closed. So I was wondering if you could provide an overview of existing USAID efforts to address the learning loss that is inevitably happening in sub-Saharan Africa, and specifically that loss for girls and other disadvantaged populations.
Great. No, thank you for that. So my understanding right now, I just wanted to get you the specific number, is that the pandemic has pushed about 279 million learners out of schools across the continent, just to give you a sense of the scale. We were talking earlier about the redirections that we've been able to do with current funding. And in education, a large amount of that focus has been thinking through how to work both with ministries of education and our local partners who are doing education on how distance learning works in a given country. Now, in the United States, we have the beauty of this technology. When we're out in the middle of South Sudan, we don't. So how do we think through that? It's been really interesting to engage with my mission director in Juba. We've been working on television and radio. We've been doing the same thing in the DRC. So even in some of the most challenging environments that we're in, we've been able to pivot and develop curriculum to at least, again, mitigate the backsliding. It's going to be no substitute for an actual in-person teaching. So there is a lot of thinking going on. There has been some pivoting going on. The work continues, to be frank. In terms of getting the specifics on how this is disproportionately impacting girls, it almost certainly is, but I'd like to get back to you with the specific statistics.
I would very much appreciate that and very much like to be helpful in assisting in that area. And my last few minutes, I'll ask one last question. So as you know, I've been working with my Republican colleagues, two of them, on introducing the Women's Global Development and Prosperity Act. It's an important initiative started by this administration to support women in developing economies. How have your agencies been able to make use of the WGDP initiative to support COVID response efforts? More specifically, how is the U.S. government leveraging women entrepreneurs in its COVID response in Africa?
Sure. And I'll get back to you with some even more specific examples, but I can think of off the top of my head, I believe Kenya and Ghana, there's a couple of others, one also we've just seen in Cape Town, of working with women-owned SMEs, particularly on pivoting small-scale F&E production of face masks. Doesn't sound like much, that's critical, absolutely critical. From hand washing and face masks, that's really what's gonna stop the spread, particularly in the urban slum environment. So that's been a key piece of the story. Also, of course, just the broad work of what WGDP does in terms of removing legal, cultural, and regulatory barriers, that is the lens through which all of our support that's being done in the SME space is being thought through. And so again, it doesn't matter which sector we're talking about, those are the lenses that we'll be asking through when we're looking at project design. But happy to get you some more stories that we have from the continent in that space.
May I add something on the State Department side? For State, one of the programs I mentioned in my remarks is the Young African Leaders Initiative, and their very large network now in Africa of young leaders. That has a very heavy focus on making sure of large participation of women, and many of them now are in leadership positions on various COVID response projects, from the village level to entrepreneurs to leadership. So they're very, very much involved in that.
Thank you, gentlemen, and I yield back the balance of my time, and thank you, Chairwoman.
Thank you, Representative Houlihan. I am going to hold my second round until after the other members have had the opportunity to ask their questions. Representative Phillips, do you have a second round of questions that you'd like to ask?
Yeah, thank you, Madam Chair. I'd like to direct my questions relative to elections. I'm concerned about the status of elections in many countries around the world. In Mali, the government chose to hold long delayed elections in late March and early April. Many voters stayed away from the polls, not just due to violence, but also due to fears of the coronavirus. Just before the elections, extremists kidnapped an opposition leader in the north of the country. And while the ruling government did quite well in the elections, protests have erupted in recent weeks as thousands have now taken to the streets calling for the president's resignation amid corruption scandals and lack of response to the kidnapping about which we're all aware. So as we look forward, there are a lot of countries with upcoming elections. Niger, Cote d'Ivoire, the government of Burkina Faso suggested moving their November election to 2021, as our president may have suggested today. Elections in Ethiopia, slated for the end of August, have been postponed and have yet to be rescheduled. There is a lot of concern, and I trust we all share it, as free and fair and safe elections are integral to our mission, the United States of America, something that we have to commit to, both domestically and internationally. So my question to you, Ambassador Nagy, is quite simple. What are we, as the United States government, doing specifically, and the State Department more specifically, to support the efforts around the world to support free, fair, and safe elections?
Super question. Thank you so much. That is one of the key elements that we have asked each of our embassies in around Africa to look at, because as you mentioned, sir, there are quite a long list of very important elections coming up, and obviously, again, this is highly dependent on local circumstances. Obviously, some governments will be trying to use COVID to delay elections unnecessarily or unreasonably, while others very justifiably may have to let them slip by a couple of months or 6 months so that they can have an environment that is conducive to credible elections. Our ambassadors are very much seized with this very issue. They are providing reporting, analysis. They're engaging with their host governments whenever something appears unreasonable, and they're working very closely with their USAID missions to devise the kind of programs that would be supportive for elections in that particular circumstance. One just came up within the last week when the very dynamic Somali Prime Minister was dismissed by the National Assembly because he had been very energized in trying to come to a national consensus on the type of elections to be held. So we're looking very carefully to make sure that those elections now are not unreasonably delayed with an excuse at the Prime Minister's departure. So that, as you said, sir, it's very much a concern all around the continent, and you can be assured that our embassies and ambassadors especially are very seized with that issue.
And I'm glad to hear that, Mr. Ambassador. If you could just also share with me, what type of cooperation are you seeing from the international community, particularly our allies, with shared interests?
Excellent question also. It just so happens that last week I had a quad meeting, over like this video with my British colleague, the United Nations, and the European Union, having to do with Somalia. And we engage very heavily with the like-minded groups because, what did we say? In unity there is strength. So, the international community, at least part of it, is very much seized with making sure that we have credible elections.
Okay, thank you, sir. With my remaining time, I'd like to just address misinformation. I don't think it's been covered yet. There's a lot of anecdotal evidence that suggests fake news and other misinformation is confusing people around the world. I know there's a report, a journalist in Burkina Faso said that many people he spoke with advised him that they didn't think coronavirus affected Africans. So both to you, Mr. Ambassador, and Mr. Maloney, if we have a moment, how is the State Department and USAID responding to such disinformation?
I'll talk on the state side and leave it to Chris to talk about USAID. Our ambassadors actually have been very much in the forefront on going out on Twitter, Facebook, local TV, writing local articles about some of the correct practices. I remember when the pandemic first started, a number of our ambassadors became TV stars for being filmed washing their hands, the appropriate way to wash their hands. So absolutely, sir, there's a lot of misinformation, but our missions through our public affairs offices, and as I said, many chiefs of missions are trying to put to rest some of that misinformation. And Chris, anything for you?
Very, very quickly, we have two programs using the COVID supplemental, one in littoral Africa in a number of states and another across the Sahel, where we've noticed this disinformation issue on COVID-19 to be particularly profound, that are working with local radio stations and local civil society groups specifically on this issue. Muslims don't get COVID-19 has been a message we've seen in different parts of the Sahel, things like that. So that's something we're definitely working on right now.
Okay, gentlemen, thank you both very much for your time. I'm grateful. I yield back.
Thank you, Mr. Phillips. Mr. Sherman, do you have a second round?
I do, and thank you so much for going last. As chair, you could go first. And of course, the president of Madagascar was touting a particular local drink as a cure. I assume, Ambassador Nagy, we did what we could to respond to that? Good.
We did, absolutely.
Mr. Nagy, the most recent statistics in sub-Saharan Africa show that almost 63% of the cases, 57% of the deaths are all taking place in one country, and that's the Union of South Africa. Is that because South Africa has really been hit harder, or is that because that's the country that's doing the testing, reporting the information? Is COVID a big problem in the countries other than the Union of South Africa?
Absolutely. Thank you very much for pointing that out. Yes, as was said several times, South Africa is showing up on the statistics with having more than half the cases. That's because they are doing extensive testing. They have a developed world health system, although they still have some developing world vestiges left over from the long period of apartheid. So that's why it's such a mixed bag there. But then you look at other countries. South Africa is I think it's about 60 million people, and you look at the number of cases. Then you look at a country like Nigeria with 200 million people, and the COVID cases are infinitesimal compared to that.
Yes, so, I mean, to look at the statistics that have been reported, roughly 8% of 10,000, so that's less than 1,000 deaths in Nigeria.
Yeah.
Would you believe there have been less than 1,000
No,
deaths
absolutely
in
not.
Nigeria?
It's a matter of, people are dying. Unfortunately, in Africa, people die quite frequently from serious diseases.
Gotcha.
But people die, and it's the cause of death is not
be
necessarily.
so.
Yes, sir, absolutely. So,
we in Congress want to reflect our values in the appropriations, but we're not the experts at the program level. On the other hand, you work for an administration that may or may not share our values, may not have an official position. Can you provide us with some what-if guidance, like if you're hell-bent on spending $5 billion to help the world, the underdeveloped world, deal with COVID, here are the programs. Could you perhaps give us percentages, if not dollar amounts? Clearly, the administration wants us to spend at least $10 on this so we could divvy up. What guidance can you provide us, officially, unofficially, so that when we reflect our values and provide the money, we give you the flexibility and the allocations that make sense? Yes. What percentage, if we're trying to help Africa and the rest of the global south, what percentage would go to which programs if the focus here is on the health problems and the food security problems caused by COVID?
So if we look at the way the current monies have been split in Africa, and again, the numbers sort of change a little bit by the day as things get obligated, but roughly right now, I'd say it's about 2/3 of the humanitarian front, about 10% is in the second and third order effects fronts, and the remainder is
10% is in the what?
in a second and third order effects, so things like democratic backsliding, economic support, things like that, and then the rest is global health, about 20%, a little less.
So considerably less on global health than on humanitarian.
That's correct.
Whereas the Senate proposal is $3 billion for global health and $1 billion for international disaster assistance. That's a different ratio than what you would suggest?
The only thing I would say is that humanitarian work is incredibly expensive, and it's not going to be getting better anytime soon. So it's important to understand operationally what's behind those proportions. So that's why it's a little bit tricky to speak strictly in proportions in terms of what's going on behind those figures. I would say that, in my opinion, the economic support piece that right now is at about 10% is certainly in the African context too small. So proportionally, I would think there should be more in that space. We've talked about that
More
before.
for economic support.
That's correct.
Global health and humanitarian and second order. Give me percentages for those four.
Exactly.
Please give me percentage.
Again, this is a off of my.
We could only be
off of my
talking
head.
about $10.
You know, it would.
Go ahead.
The need here is great, right? So I think as we look forward, I don't think the humanitarian or the health issues are going to be going anywhere anytime soon. So just as much is needed in those spaces as elsewhere, and we take what we can have and we can maximize that accordingly. 10 to 15, 20% more on the economic growth front, I think that would be useful, but that of course comes with trade-offs, right? We're going to have trade-offs in a world of fixed resources. I understand that, but if I look at where COVID-19 is health again, I would put that at least at that same proportion, 20%. And so again, you'd see reductions more on the humanitarian.
Humanitarian?
And that's where I would take the cuts. But again,
You mean spend less on humanitarian?
This is what I mean by trade-offs. So in terms of where we see things going,
Okay.
more than anything else. At the end of the day, though, again, those I don't want to see as official figures. I'm just simply talking about a reproportioning of where we are at a very, very high level. But if I look forward in terms of where COVID-19 is going in Africa, it is the...
I'll give you a call. I yield back.
Thanks, man.
Mr. Sherman thinks I was being magnanimous, but I don't often get the opportunity to wield the gavel, so I'm going to take full advantage and actually ask the questions that I normally don't have time to ask. But I'd like to start with just, don't even put your mask back on, Mr. Maloney. If you could just finish that thought that you had, that you were expressing with Mr. Sherman about where we're going with COVID in Africa.
So I'm just going to go back to my testimony, and that's where we don't know what we don't know. We know certain countries are getting hurt very hard. Just following up on that South Africa comment, I think is important. South Africa got hit worse than everyone else because of what it is, right? It is the most globally exposed. It has an older population, and it has the ability to test, so it's a mix. Are we going to see it's not a second wave, are we going to see the wave just pitch later elsewhere in Africa? We don't know. We need to be prepared, but I do think that we are seeing signs that pieces of the continent may have dodged a bullet if they're able to keep things under control. I'm very worried about, I think it's more about pivoting as the wave recedes in South Africa to where it's going to pick up, which is primarily littoral West Africa, so Cote d'Ivoire, Ghana, Nigeria, that area. If we can keep everything else under control, though, what really keeps me up at night are the second and third order effects, and to some degree the humanitarian effects, because the humanitarian issues are always going to be there. The food security is going to be there. But at the end of the day, it is the global economy, as we saw today in the reports in the United States, that is going to hit Africa really, really hard. So global supply chains are broken. Farmers cannot get their inputs. Farmers can't get products to market. The urban poor cannot buy their products. So the food insecurity piece is very real. I saw a report yesterday that said 70% of households in Africa, this was specific to a Nigerian survey, are reporting income losses. So when you mix all of that together, the real thing that we're going to see over the next 6 to 12 months is a profound economic crisis, right? And so how that plays out, what those right issues are, that's what we're going to have to start thinking through, which is a little bit different than sort of the classic health piece that we've been doing to date. So it's hard for me to recalibrate the proportions so specifically, only to say that, Tibor and I worked very closely on this. When we were looking at the proposals coming from the field in this second and third order space, there are an amazing amount of ideas, but not enough funding for them. And that's where I think a lot of the long-term issues are going to come from.
Thank you. Before I get to my next question, go ahead.
Can I add to
Ambassador.
that? With the secondary effects, there are other things that very few people talk or think about. The large increase in violence against women. Huge problem, but again, not often talked about. So many African countries count on tourism for large portions of their gross domestic product. Tourists aren't coming. The people who are engaged in tourism at these national parks are losing their livelihood. So what happens then? They start poaching animals, and because we know there's a market for ivory and pangolin scales and things, so those could, again, become embedded in the systems, and we have spent such efforts to get that out of there, to get people to be park rangers instead of poachers. But they can revert very quickly. So there are a whole lot of these secondary cases. More than official statistics, one of the things I'm depending on to kind of get a sense of where countries are, our embassies overseas follow a phase system, kind of like we did here. Phase 0 to phase 3 is normal. And in Africa right now, about a third of our embassies are still in phase 0. About half now have gone to phase 1, and about a handful are phase 2. So our embassies take a really good look at the local circumstances and make their recommendations based on that. So I look at that a lot more credibly than some of the statistics coming out, like, Tanzania stopped counting on April 29th. So
I just need you to explain the phase 0 to 3.
Phase 0 is basically the embassy is open, but most people are telecommuting.
Okay.
And then phase 1, it goes up to more activity and more activity and more.
So the lower the number,
the more difficult the circumstances.
Got it. That's what I needed the clarification on. Switching gears, I wanted to talk about how foreign assistance funds that are appropriated by Congress, and specifically of late under Public Law 116 to 123 and Public Law 116 to 136, how are they being allocated in Africa? Some people have alleged, observers have alleged, that the bulk of these appropriations remain undispersed and that aid pledges have outstripped deliveries. So if each of you could just address what bottlenecks, if any, may be hindering disbursement in Africa.
So first of all, thank you for the question. So to get this much money out the door this fast is a mammoth task. And so I'd certainly say in the early days that criticism is very valid. I don't have the specific statistic right now, and I'm happy to get it for you. My understanding is we've been able to obligate now, I think, about 70%. And my understanding is of the humanitarian IDA funding, it's supposed to be all obligated by tomorrow, which is great. So at the end of the day, though, we're trying to balance two things. One, the incredible urgency of getting that money out the door to real fires and real needs around the world, but we have to be responsible to the U.S. taxpayer. We have to make sure we're being accountable for that. So all of those strictures, all of that coordination we need to do with state and the rest of the agency to make sure that we're not duplicating efforts, that we're all aligned, that just takes time. And I think at the end of the day, though, it's remarkable how much we've been able to do in 2, 3 months, 4 months at this point. So,
Ambassador, did you want to say anything further on that? Okay. And then I wanted to ask you about ventilators. You talked about financial assistance, but there's also been specific pieces of medical equipment. As we move forward, hopefully there will be tests developed that will be distributed within Africa. In my district, we have an excellent company that has actually has rapid tests for Ebola and HIV that have been distributed in Africa. They're working on one now for COVID. And so I guess my question to you is, well, let's just stay with ventilators for now. Which countries have received or are slated to receive ventilators, if you know? And as long as I'll ask you the whole question. Also, I wanted to have you address PPE aid.
Sure. So to date, we have 9 countries that have been slated to receive ventilators. It's important to understand that ventilators are very complicated pieces of equipment. So to date, deliveries, my understanding so far, is really only South Africa and Rwanda. But literally over the next coming weeks, this list, the deliveries themselves will grow. But the 9 countries are Democratic Republic of Congo, Ethiopia, Ghana, Kenya, Mozambique, Nigeria, Rwanda, South Africa, and Zimbabwe. These were all requests between heads of state. This was not a process by USAID. This was led by the White House as gifts from the United States to these requests to these governments in Africa. I will say, personally, having overseen this because USAID is delivering these ventilators, we have done a huge amount of work to ensure that these ventilators are successes in these countries. That's at 2 fronts. One is we've been doing what are called oxygen ecosystem assessments. So a ventilator is one piece of the broader oxygen story. So you need to look at where these things can go, the availability of durables and consumables, the technical assistance, that piece of the story. So we're doing full assessments in our countries so that we can make sure the wraparound support that USAID can provide is there with the ventilators. The second piece is what we call facility level assessment. So where does the ventilator actually go? That's another piece of the story that I've been working closely with, so that we're working hand in glove with the ministries of health on that piece of the story, again, so that these gifts are a success. But I think what's interesting that's come out of this is, as we look forward, I think there's a real need for potential oxygen investments in Africa. So production of oxygen, the TA for the oxygen, technical assistance for the oxygen, and again, the sort of durables and consumables go around it, like the tubes that would go in your nose and that sort of thing. I think as we've watched this crisis play out, we've learned a lot about the role of ventilators versus oxygen, and this might be an interesting thing to explore as we look forward.
Thank you. Ambassador, did you want to add anything to that? And you mentioned that these ventilators, have they all been gifts from the United States to these countries at the request of heads of state?
In Africa, they are gifts, yes.
And do you have any idea what the value of these gifts are?
I'd have to get back to you on that number.
That's okay. I just wondered if you did. So my last question to both of you, it's going to be a kind of a simplistic question that I suspect doesn't have a simple answer. But it's something that we in Congress always have to answer for, and I think it's a very important question, and that is, why should the United States taxpayer be concerned about what is happening with COVID in Africa? Ambassador?
Can I start? I think that question also is, why should the United States taxpayer be concerned with Africa?
Of course.
Because
yes.
everything. One, as I mentioned, I think earlier, Africa's population is going to double between now and 2050. It has forever been seen as a problem in our policy, since we recognized relations with the decolonized countries in Africa. Now, I think people are seeing it finally as an opportunity. Certainly our global competitors see it as an opportunity. With that many young people, they could either be they're going to be there. They could either become a tremendous, unfortunately, force for global instability, fodder for violent extremist organizations, millions migrating to Europe, or they could become a tremendous force, dynamic for global economic growth, and they could be billions of customers instead of problems. And the truth is that African young people have access to mass communications, and they have exactly the same dreams as young people anywhere else in the world. A good job, a good home, being able to support their families, opportunities, educational opportunities. And the elites who have been running Africa, often in a very corrupt way, are on the way out. And the young people are going to be there, and it represents a tremendous opportunity for U.S. prosperity and security, frankly, to be engaged there. Because as I said, if we're not there, the vacuum will be filled up by other people. And we also have to remember that in international organizations, a country like the Seychelles has the same vote as the United States of America. and there's at least 50 whatever votes that Africa can provide.
Thank you very
Over to
much,
you, sir.
Ambassador. Mr. Maloney?
Sorry. Thank you. The way I look upon this is I go back to our national security and our national security strategy, where a key pillar is advancing American influence. And it sounds strange to say, but if ever there was an opportunity to advance American influence, it would be through what's happening right now with COVID-19 in Africa. And I look upon that in three lenses. The first is the American taxpayer should want to protect their $100 billion of investments in basically stopping the tidal wave of HIV/AIDS. I'm just thinking back to grad school 25 years ago and what was happening in Africa for HIV/AIDS and where we are today, and that is all because of PEPFAR and the American taxpayer. This is an opportunity to protect that investment. Secondly, to demonstrate American leadership countering malign influence is critical. We've already talked about China with Congressman Burchett's comments, and I completely second those, and this is a key opportunity to do that. And then finally, I just want to speak to the moral imperative. America stands up for the most vulnerable, and there is no more vulnerable place in the world, I would argue, than the African continent, and this is our chance to do that.
Thank you very much. Do any members have any additional questions? Hearing none, member questions are now concluded. I once again want to thank our witnesses for being with us today to discuss what I consider to be an extremely important issue. As countries, and you obviously have demonstrated your tremendous knowledge in this area, I suspect we could have continued this conversation for a couple of days. As countries around the world grapple with the COVID-19 pandemic, we want to be certain that the United States is playing a constructive role in doing everything that we can to address and assist other countries as they respond to this pandemic. And we also want to make sure, as you referenced, Mr. Maloney, that countries do not lose many of the gains made in the last few years, many of which have been gains made with the assistance of the United States and our investments. So thank you very much to both of you. This meeting is adjourned.